This video is to demonstrate how to document patient education in a patient's chart. You will enter into the SimChart for medical records either using your EHR exercises or your numeric assigned exercises depending on the instructor's instructions. First, you will click on Find Patient. This will open the patient's medical record. You will locate the patient. You will click Select. When generating an treatment of any kind, even something as simple as patient education, you will need to click on Create New Office Encounter by clicking Office Visit. On the left, Information Panel. It will open the actual patient's chart. You will see any open encounters or visits that the patient has come in. If the date of the encounter does not show up, then you can click Add New Encounter. If the doctor has ordered you to educate the patient on a specific date of service or item that he ordered during that date, then you can open that encounter to make amendments. If the date of service is not showing, or it is a simple occurrence where the patient has walked into the office and you need to document the patient education, then you will click on Add New Encounter. You will select the appropriate date, the type of visit, in this particular case, for these types of just walk-in education, if it was an annual exam, you would pick the appropriate visit type. For our demonstration purposes, we'll click Urgent Visit. Select the provider that has ordered the patient education, and then click Save. This will take you into the actual documentation area of the patient's chart. At this point, if you are doing patient education, the default record will show all of your drop-down options. This is where you will click on patient education if you are needing to document the patient education that was provided. So click on patient education. This will open, it will default to any new patient education that you are generating. If you have generated previous patient education and you need to view it, you have an option to click on Saved. In our case, we're generating new patient education. So you have a category. Notice the red asterisk. Demonstrate you have to click and complete this section. So click your drop down arrow. You will click either Diagnosis, Health Promotion, Test, or Procedures. So if you click on Diagnosis and then your subcategory, click the drop down again, it will give you it will give you preset options. This is patient education or diagnostic patient education based on specific diagnosis that the patient has been given or documented within the chart that the patient needs to receive patient education on, such as cardiovascular, digestion, nervous, musculoskeletal, respiratory, urinary systems. Trying to see if we had anything such as diabetes, So once you select a subcategory, it will open up different topics. So blood and immune, you have mononucleosis, anemia, allergies, multiple myelomas. So you can click on each one of these subcategories and you can see your different types of diagnosis options that are available. Change your initial category and select subcategory, and it will give you other types. So here's our community resources. We'll be doing an assignment on this community resource for our patients that have addiction, anger management, asthma, eating disorders, Alzheimer's. So you can scroll down through here and see the different pre-populated patient education forms that are available for you to review. So if we wanted to do smoking, you click on smoking. You're going to view the document so that it gives you the purpose of this. It's provide an opportunity for participants to share experiences regarding the process of quitting smoking. Your contact information, meeting details, and any additional information that patient may need. So this is the educational topic and community resource referral for our patient. If you are required to print this out, if you're using Google Chrome, then it will give you the option in the drop down to download it or print it as needed according to your instructions. So that allows you to view what that document is. If it was on, let's see, drug addiction, these are teaching topics. So what is it I'm teaching them? You can view it, review it with your patient, download it or print it. So if we wanted to print it to give to the patient, then we could do so. Once you're finished, you can close the tab. And then the last section, who did you talk to? Were you teaching the family member, the parent, the patient, a significant other, a spouse, or was it a third party? You can click multiple people. And then what was the method? Was it a demonstration? Did I give them a printed handout? Did they, in return, demonstrate it back to me? Or was it simply a verbal explanation and discussion? So you can click as many as apply and as what you would have done with the patient to document. Once you have completed this, you will hit save. And now it has documented. You notice the green bar says save successful. And then you have your encounter type, community resource. It gives you record date and time. You can click the drop down to see exactly what you did. Close it back. If you clicked on the wrong one, because we have not come out of it, you can currently delete it if need be. If you need to print, then you can click the printer option and notice. However, it does not give you any of this additional information, even though we clicked it. Notice it only shows the 4 that I clicked. It doesn't show them all. If I need to edit, then I can come in here and edit. Here are the other 2, the learning barriers that were left blank. It allows me to see, oh, I didn't finish filling that in. Were there any language barriers that we had to overcome? If there's not, you click no barriers. If there was time limitation, the patient needed to leave, we didn't have time to go into it for details, age development levels, cultural or ethnic backgrounds, defense mechanisms, emotional or mental state, any of these that you feel might be an issue that could have interfered with this, you would need to select it. The outcome, was the patient able to give a return demonstration? So up here, teaching method, return demonstration given. Were they able to do it back to you? Needs practice to perfect. So you select the appropriate. You can select multiple options. If there's additional information that you need to enter, then you can do so here. Make sure that you include your appropriate credentials at the end of any information you have typed out in a narrative information box. You will then click Save, click OK. Hopefully SimChart will continue, because we need to save our changes. Okay, save is successful. That's what I was looking for. So now I can go up here, minimize. It's still there. If I want to print it, notice now it is filled in and it shows all of the information that has been selected. I can print it and drop it to hard copy, or I can save it as a PDF to upload into my Blackboard assignment. Once you have completed this, then you are able to submit this into Blackboard or submit your hard copy within class. Quick summarization: to generate patient education and document patient education, you will be required to find patient, select your appropriate patient. You will have to generate an office visit. You will either select from previous encounters. So once we select our patient, I understand. Once you go to find patient, select your patient. It will default back to patient dashboard. Locate your appropriate encounter and edit it accordingly. Or if you need to generate a new one, you would click Add New. Go to your records drop down and select patient education. Notice that it now is in bold. That means I have some type of documentation under that particular category. Click on the category. If I need to generate a new one, so say I also gave them patient education on a test that we're needed to perform. Pathology, your category, subcategory, and then you will select the appropriate document. You can view it, download it, or print it. Your persons taught, you will select and identify each of those, the different teaching methods that you utilized. Document any possible language barriers that you noticed. Document the outcome. This is the confirmation, whether they understood, did not understand, and then any special information or notations at this point, followed by your credentials. Click Save, and then click the little printer icon in the upper left-hand corner to open and print the individual document or save it as a PDF to upload. If I want to delete because I have not come out completely, this particular educational EHR will allow you to click delete. It's going to ask you to confirm. You hit OK, click OK. Notice it did not take it all the way away. You did a simple strike through. It says it was deleted and the time and date that it was deleted. That concludes the video for documenting patient education on a patient's different diagnosis or procedural information.